COVID-19 summer wave, 26 states see rising cases, CDC data, new variants and booster guidance. Police cars revolving light ***, the summer surge is here. Are you prepared for the unexpected? ***, police cars revolving light. As summer unfolds, a troubling pattern is emerging. ***, COVID-19 cases are climbing in 26 U.S. states and Washington, D.C. ***, according to the latest CDC data. This isn't just a blip, it's a full-blown summer wave, with emergency room visits for children under 4 hitting their highest levels since March. But here's where it gets tricky. While the numbers are rising, the ***y** and ***what's next** are sparking debates across the medical community. ###***, the summer spike, a new normal, ***. Dr. Jon LaPook, CBS News chief medical correspondent, calls this the typical rhythm of the pandemic. We now see winter surges followed by summer surges. He points out that hospitalizations and deaths have been declining seasonally, which is a silver lining. But, as he warns, ***, this isn't the time to let your guard down ***. If the virus hits you, it can be devastating for vulnerable groups, very young kids, the elderly, and immunocompromised individuals. Millions of people are at risk here. ###, new variants, less deadly, but still a concern ***. The latest strains, informally named ***, Nimbus ***, and Stratus ***, aren't more lethal than their predecessors, LaPook explains. Symptoms mirror those of earlier variants: coughs, sore throats, fevers, and fatigue. Even the NB.1.8.1 variant from earlier this year didn't cause more severe illness. But here's the catch, ***, just because they're not deadlier doesn't mean they're harmless ***. For those with weakened immune systems, a mild infection could still lead to hospitalization. And this is the part most people miss, ***, the vaccines do cover these variants ***. That's the good news, if you're up to date. ###, vaccine recommendations, a divided landscape ***. Here's where the controversy kicks in. The CDC now advocates for shared clinical decision-making for healthy children and pregnant individuals. That means ***, no one-size-fits-all guidance ***. For example, the American College of Obstetricians and Gynecologists strongly recommends vaccines for pregnant people to pass antibodies to their babies. But the CDC's approach is more cautious, urging people to consult their doctors. Health Secretary Robert F. Kennedy Jr. even called it a shared decision, which is a shift from previous blanket recommendations. ***, should you get a booster? ***, the CDC still says yes, for adults over 65, those at high risk, or anyone who's never been vaccinated. But for others, the decision is now more personal. ***, what's your take? Do you think the CDC should be clearer, or is personalized advice better? We want to hear your thoughts in the comments. ###, where the surge is hitting hardest ***. The CDC has identified these states as experiencing ***, growing or likely growing ***, case numbers. ***, rising cases ***. Arkansas, Hawaii, Illinois, Iowa, Kentucky, North Carolina, Ohio, Pennsylvania, Texas, Virginia. ***, likely rising cases ***. Alaska, California, Delaware, D.C., Georgia, Indiana, Maine, Maryland, Massachusetts, Michigan, Mississippi, New Jersey, New York, Oklahoma, South Carolina, Tennessee, Wisconsin. ###, the bottom line, stay vigilant ***. The message is clear, ***, don't be complacent ***. While the virus may not be as deadly as it once was, it's still a threat to vulnerable populations. Vaccines work, but only if you use them. And as the medical landscape evolves, staying informed and asking questions is more important than ever. So, what's your plan? Will you talk to your doctor, get a booster, or just wait it out? We're curious to know. Thinking face. California summer COVID wave, is this the start of a deadly surge? The rise in COVID-19 cases in California is raising eyebrows and prompting questions. Are we witnessing the onset of a summer wave? Recent public health data suggests that this could indeed be the case, as COVID-19 infections are once again on the upswing in the state. According to estimates from the Centers for Disease Control and Prevention, CDC, approximately half of the states across the U.S. are experiencing an increase in infections. The latest update from the CDC, released on a recent Friday, highlighted a surge in COVID-19 activity in over 24 states, particularly in the Southeast, South, and along the West Coast, with California being a notable example. On a national scale, COVID-19 levels are currently categorized as medium based on wastewater monitoring data. This marks a significant increase from the very low levels recorded just a week prior, indicating a clear upward trend in cases. In California specifically, wastewater surveillance has confirmed that the virus is indeed spreading. The Wastewater SCAN program, which monitors viruses in sewage, reported that 95% of the testing sites in the state showed traces of COVID-19, with the amount detected rising since June. Researchers noted in a report dated July 14 that, as has been observed in previous years, levels of the virus may increase during the summer months. Last month, the CDC reported an average of 150 COVID-19-related deaths each week, underscoring the ongoing impact of the virus. Public health experts attribute the summer surge in cases to several factors, including increased travel during the July 4th holiday, large gatherings such as concerts and sporting events, and people spending more time indoors during heat waves. Additionally, waning immunity among individuals who were last infected or vaccinated more than 6 months ago is also contributing to the rise. While current virus levels are slightly lower than those recorded at the same time last year, the steady increase mirrors familiar seasonal patterns. Genetic sequencing from wastewater samples indicates that the LP.8.1 variant is currently the most prevalent, accounting for 33.2% of sequenced samples, followed by the XFG variant at 24.6%. The NB.1.8.1 variant, informally dubbed the razor blade throat variant due to reports of painful sore throats, makes up 7.5% of the samples. Despite its concerning nickname, there is no substantial evidence to suggest that NB.1.8.1 leads to more severe illness or higher hospitalization rates. Nevertheless, public health officials continue to advocate for vaccination, testing when symptoms arise, and the use of masks in high-risk environments. Dr. Peter Chinhong, an infectious disease expert at UCSF, emphasized the importance of vaccination, particularly for vulnerable populations such as individuals over 65, those who are immunocompromised, pregnant individuals, and infants under 2 years old. He recommends ensuring that these groups have received a COVID-19 vaccine within the past year. A recent CDC analysis suggests that COVID-19 has established a pattern of biannual surges, typically peaking from July through September and again from December through February. Scientists attribute this cyclical pattern to genetic changes in the virus's S1 region, a crucial part of the spike protein that allows the virus to attach to human cells. The report stated, "Our analysis revealed biannual COVID-19 peaks in late summer and winter, a pattern that is expected to persist as long as the rapid evolution of SARS-CoV-2 and cyclical S1 diversity continues." Historically, California's summer wave of COVID-19 cases tends to peak between mid-July and late August. As we navigate this evolving situation, it's essential to stay informed and proactive. What are your thoughts on the current rise in cases? Do you believe we are prepared for another wave? Share your opinions in the comments below. COVID-19 levels rising in the US, what you need to know. COVID-19 is quietly creeping back into our lives, and this time, it's the west and south regions of the US that are feeling the heat. But here's where it gets concerning. While overall cases remain low nationally, the Centers for Disease Control and Prevention, CDC, has flagged a noticeable uptick in infections across several states. And this is the part most people miss. Early indicators like emergency room visits and test positivity rates are starting to climb, especially among young children under 4. For instance, ER visits for COVID-19 jumped by 10.9% in the past week, though they still account for just 0.5% of all visits nationally. Test positivity has also inched up to 4.8%, a 1.1% increase from the previous week. Wastewater surveillance, another critical early warning system, shows SARS-CoV-2 levels rising in states like California, Florida, and Texas, signaling potential trouble ahead. What's more, the CDC hasn't updated its variant projection since June due to limited data, but earlier reports hinted at the spread of newer subvariants like NB.1.8.1 and XFG. Controversially, some experts argue this could be the start of another wave, while others believe it's just seasonal noise. What do you think? Is this a blip or something more serious? Let us know in the comments. Meanwhile, across the Atlantic, Europe is grappling with its own set of health challenges. Italy has reported its first locally transmitted case of chikungunya since 2017, in the northern province of Piacenza. France isn't far behind, with 30 confirmed cases spread across 12 regions, including a cluster of 13 in Salon de Provence. But here's the real kicker. Dengue fever, another mosquito-borne illness, has popped up in France, Italy, and Portugal, raising alarms about the spread of tropical diseases in temperate climates. France and Italy each reported their first local dengue cases of the year, while Portugal's cases in Madeira earlier this year likely stemmed from 2024 transmission. The European Centre for Disease Prevention and Control, ECDC, has responded by launching new weekly updates and guidelines on mosquito-borne illnesses, but the question remains, are we prepared for these diseases to become a regular fixture in Europe? Some argue that climate change is to blame, while others point to increased travel and globalization. What's your take? Share your thoughts below. This is a conversation we all need to be having.